Hi, my name is Ava Marasic. This is my story about my scoliosis and how I was successfully able to correct it. So, when I went to my annual pediatric checkup, I was 14 years old, and my doctor bent me down, and in California, the doctors are required to check for scoliosis, and he noticed that I had a slight rib that was higher than the other, which was very surprising because I had no obvious signs. I didn't visually look it unless you really were an expert at it, which at the time none of us were, and I wasn't having any pains at all. So the doctor sent me to get an x-ray, and at first they said that it probably wasn't going to be that big of a curve, but then the x-ray came back and it was 36 degrees, which is pretty high. So why and how did this happen? Well, what happened was that me and my parents just had no research and we knew nothing about it. So my parents went into research mode. They met with our pediatric, who refused to do a pediatric clinic look, which sucked. So the outlook didn't look good. We went to a local doctor and they suggested we either have surgery or have a brace to make sure it doesn't get worse, not to fix it. So our choices were not looking very good. So we decided to seek help from a non-surgical scoliosis treatment. It was considered an alternative. So how it started out is I had 2 weeks of intensive boot camp. I learned about a bunch of different exercises. I had equipment that they created, and it was customized specifically to my curve, and I learned a bunch of different stretches, and I learned specific exercises that strengthen my core and to help stretch my spinal cord. So the pain and discomfort was very, very intense at first, and it made it even more intense from the fear of the unknown. I had no clue what was going to happen going into this. I had no clue if my spine was going to work with the program, and I was especially really scared to go back to school. I was terrified that everybody's going to think I was that girl, or the girl with the brace, or just the weird girl. But in the end, let me tell you, that didn't happen. So I wore my brace for 21 to 23 hours a day for 3.5 years. It was a lot. I had a very, very intense and rigid exercise program. If I didn't wear the brace for 21 to 23 hours, even just for one day, it could really affect me. And because of all my intensity, my curve is now down to 17 degrees, so yay! So not only was my curve reduced, but I avoided surgery. So was it worth it? Absolutely. I believe it was very worth it. So I don't have pain in the future, and I don't have pain from surgery. So these are my results. This was me when I got my very first x-ray. This was from the doctor, and the one on the right is from the clinic. This is my brace. This is my back 12 hours out of brace, which is very good. So how am I today? I'm only wearing my brace for 10 hours a day, which is what my parents call it. I graduated from wearing my brace, and I really only have to do that for 9 to 12 months more. The reason I'm only wearing it for 10 hours is not only to keep my spine in place, but also to make sure I grow back those core muscles. So I no longer have to wear my brace to school, which means I can express myself through my clothing a lot more, which I'm super excited about. And I have to regularly exercise, which I don't mind. I always exercise all the time. I go to the gym, I play sports. So if anything, it's a blessing because then I will be encouraged to exercise my whole life. I will never have any scoliosis related pain, which is great. Other than, I guess you could say, the physical therapy was pain, but it was a good type of pain. And because of it, I get to live a normal and active life. So I created a channel around people knowing that you are not alone. because during my scoliosis journey, I felt very alone. I felt like there was nobody else going through this with me. And when I looked up like support groups, there wasn't much from one child to another. It was an adult to a kid or an adult to parents. I felt like there wasn't much support for me, the actual patient. So I created a YouTube channel to help other teens and kids with scoliosis know that they are not alone, and that there's so many other kids out there who are going through the same thing. I'm just another teen with scoliosis out there for you, and I'd love to give advice. If you want to check out my YouTube channel, it is Embrace the Brace with Ava, and the QR code is right there. Thank you very much.
Hi, I'm Keegan Connor. I'm 16 years old, and when I was 13, I had VBT, or vertebral body tethering. So Ava, amazing story. My first question for you is, you talked about using specific equipment configured to your curve to help with correction. And what was the most challenging but yet rewarding part about such a rigorous experience?
So I believe the most challenging and the most rewarding for me was this mechanism called the chair. It was like my brace, except more intense. So it had ropes and like belts, I guess you can call it, that pushed my spine straight. And sometimes it over strained it because it's an intense brace. And I was in it for 20 minutes a day. And it really was very painful for the first, I'd say 3-4 months. But after a while, the pain calmed down, and it made me feel good about myself because I knew that clearly this thing is working and clearly I'm overcoming all this fear. So I believe that was the most rewarding.
Awesome. I also wanted to say it's so cool that you created a YouTube channel to give hope to others living with scoliosis. So what was your favorite piece of advice from one of your YouTube videos?
So I say the biggest piece of advice is to make sure you have a good support group, people who care about you and people who you know will help you every step of the way. I believe that is the biggest thing.
Thank you, Ava.
Hi, I'm Mary Dixon, but my questions are, what's one thing or exercise that anybody with scoliosis could do to improve their curve the most?
I would say I'm not a medical expert, but I would say that core is something that I was told is very, very important to have a good core, especially so you don't have pain when you're older. And I do stretches in my legs to stretch the muscles in my spine and my spinal cord and all that. So I believe those two are the most important exercises.
Okay, thank you. And what was the most difficult thing about wearing the brace?
I think the most difficult thing was definitely what people will think of me. The brace itself, in the end, after 2 or 3 months, it really isn't that bad. It's just the social aspect.
Okay, thank you.
Hi, my name is Kaylin Harvey. I was diagnosed with a scoliosis S-curve at age 12. I did alternative treatments and got a corrective brace around the time I turned 13. My curves have now had meaningful reduction. I'm 16 and I'm wearing my second brace. Ava, your story was really inspiring to me because I think it's very similar to what I've done with just the alternative treatments and bracing and everything. So my first question for you, like I mentioned, I've been wearing a brace, and I know that it can be really hard some days to keep putting it on and keep wearing it. So what have you used as motivation to keep wearing your brace even when you might not really feel like it?
I believe the biggest motivation, first of all, is that I don't want scoliosis. I don't want a curvy spine. So I believe that's one big motivation because that's a personal preference. And something else is a big motivation is I would have the clothes that I can't wear because of my braids in my closet just to show that eventually one day I'll be able to wear them again. And I think that was something that really helped me push forward.
That's really interesting. I think that that's really good. So my second question is, what inspired you to start your YouTube channel, and how do you hope to continue using it as a platform for scoliosis awareness in the future?
So I never really had necessarily the confidence or the time to do it, but recently I'm part of Girl Scouts. So recently I started my Girl Scout Gold Award project, which is the highest, most prestigious award of Girl Scouts. And you have to do something that's very impactful and changes a community, and also stays. So it's a continuous thing. So I thought the perfect opportunity to talk about scoliosis and bring awareness to it. So that's why I thought it would be such a great idea to create a YouTube channel. And I'm planning to create more videos and just answer any questions that anybody has and just help people as much as they can.
That's great. Thank you so much.
Thank you, everybody here, for all the really interesting questions. Thank you.